Okay, so I wanted to go ahead and videotape like my explanation about the trip. A lot of people have been asking about how it went and to tell them, like what did you see and what did you experience, and I figured that I could go ahead and at least videotape some of it so that you guys can learn about what happened. Um, I wrote a post about a day and a half before we left, and I had intended to post it on Facebook as my status, um, but I never did, so I figured I'd just go ahead and read it. So I wrote, as we depart from the wonderful continent of Africa and the breathtakingly magnificent countries of Swaziland and South Africa, I've had time to reflect on this trip. What started off as a summer study abroad course became a small yet immeasurably significant time in my life. I thought that the time we spent in Swaziland would be monumental and change me completely. I envisioned a drastic improvement spiritually, mentally, and physically. While there were minor changes, nothing on the scale I had hoped for actually evolved. What did occur, however, was a new appreciation for all the little things in life. Real ketchup, toilet paper in every stall, everywhere. Brushing my teeth with sink water, like not having to use bottled water. Being able to see my mom. I normally see my mom at least 3 times a week, and it was really hard not seeing her and not being able to talk to her every day. Laundry machines. Oh my gosh. It's so much nicer to have a laundry machine instead of doing your laundry in the bathtub. Being able to call my best friends and just talk to them. Knowing how to count change. Like, okay, converting from dollars to rand, $1 is 10 rand. So it was like, okay, well, if something is 150 rand, that would be $15. That's easy. But then they would say, like, oh, it's 78.46. Well, like, 46, like 40 would be 4 cents. 6 doesn't exist in the US, so it was extremely confusing. No exposure to TB. It's kind of nice living in the US where most people, don't have TB. And I actually had several patients while we were there that had TB. I was in a clinic at one point, and I had this little girl, and she spoke English fairly well, and pretty much every patient that came in that said that had some sort of a cough was like, okay, I had the flu. And I was like, okay, so what are your symptoms? Like, what's bothering you? And she was like, well, I have a cough. And I was like, all right, well, are you coughing up anything? Like phlegm, mucus, like you would with the flu? And she was like, no. And I was like, okay, well, write it off as like a dry cough, just like everyone else. And she was like, but I'm coughing up blood. It's like, great, awesome. And in Swaziland, there's no sense of personal space. So when you talk to people, you are up in their face. And I'm like, I am 100% exposed to TB now. So that's awesome. So, yeah, it's nice being here where I don't have to worry about that. Being able to carry on a conversation with a stranger in English, like going somewhere and knowing that they're going to speak English and understand you, whereas there, not so much. Resources needed in the hospital. This is one of the biggest things that I was extremely frustrated with. I had a patient, she was a 5-year-old, and she was a burn victim. Her gogo, which is Siswati for grandma, she had a pot of boiling water on the stove, and I don't know if the little girl pulled it down on herself or the grandma turned around and knocked it on top of her, but it was covered, like, from her arm, all down her back, on her stomach, like, it was everywhere, and it was horrible 3rd-degree burns, and so they went and took her into surgery. They took skin grafts off of her left leg and then put it on her right leg, and the surgeon had told them to leave the bandages on for 10 days, and that's not right. Like, we don't do that here in the US. And they went to remove a top layer of the bandage, and it was green all over, and it was Pseudomonas. She has massive infection, and the skin grafts weren't taking. It was just sloughing off. And I mean, she was completely dependent on a vent, and she had some sedatives, but you could tell that she was in pain anytime that we moved her, because her heart rate would just jump, and her respirations were intense, and her eyes would just bulge out. And I was just so frustrated, and I just looked at the nurse, and I was like, we have to remove these bandages. We have to get her clean. Like, this infection needs to be taken care of. And so we went ahead and took off the bandages and cleaned her wounds, and we went to put sterile gauze on, and I was asking for more pieces, and she was like, that's all we have. And she was like, you can go look on the floor. So we were in the ICU, so I went around to the different cabinets that they had, which was 2, and I was looking for sterile gauze, and I didn't have it. And so then she said to go over to the renal unit and ask for sterile gauze there, and I went over there, and they had nothing. So I went back and told the nurse, I was like, what are we going to do? And she was like, there's nothing we can do. So we just left part of it open and exposed. And she was in an isolation room, but I was just so frustrated. I mean, this little girl had been in the hospital for over 2 weeks and didn't have the resources that she needed to treat these burns and this infection. So it was really hard to not give my patients everything that I knew they needed. So that was frustrating. Let's see what else I wrote. Sterile technique doesn't really exist there. It was really hard to see them make a big point about opening sterile glove packages and, do it just like we would here. Just open it, not touch anything, put one glove on, put the other, have it out, and then touch their hair. Or, touch the table. Or move the sheets before they even got close to the patient. And I was just like, okay. So we're doing that. Alright. And so that was very hard. It was very hard to not chastise them, I guess is the word. I mean, I understand they are doing their absolute best with what they have, and they work really hard. I can tell you that the people that I've interacted with in Swaziland are the most resourceful people I've ever encountered. They might not have all the resources that they need, but they know how to make do with what they have. Absolutely brilliant. So the little girl that was the burn victim, she started to have really bad foot drop, and they didn't have one of those boots or any sort of splint, so they made, I forget exactly what they used, but they made a splint for her. And it was just, I was just so excited, that they at least did something to figure it out and fix it. And so that was good. But the sterile technique killed me. I mean, that was one of the first things we learned in nursing school, was careful attention to sterile technique. So it was really hard not following those guidelines. Let's see. Oh, American food. There were 2 different places that we went, and I ordered a cheeseburger, and it was not meat. I don't know what it was. I want to say it was Sloppy Joe, but I'm not sure. I didn't realize I was a picky eater until I went there, and then didn't really want to eat anything. So, some of the stuff they had, incredible. And I mean, a lot of it was delicious, but one of the places we went had fried worms, and that's just not my thing. Like, I'm sorry. I know it has a lot of protein. It's just not my thing. Being able to actually take a shower was lovely when I came back, because while we were there, we stayed in the nicest place that they had in Swaziland. But they didn't have consistent water. So the water would just shut off and wouldn't come back on for a day and a half. And if we were in the shower and the water was going, it would be frigid ice cold, and then the next second, searing hot lava. So I got pretty used to being dirty. And the water, I don't know what it was, but the water made my hair extremely greasy. So I was very excited to come home and sufficiently scrub my hair. It sounds like a lot of complaining, and I don't want to sound like I'm complaining, because this trip was, I mean, it's something that I've wanted to do my entire life, and I am so just beside myself about how blessed I am that I was actually able to go and experience this and meet the people that I met and make friends with the group that I was with. The girls that I went on this trip with will be lifelong friends. Like, you guys know I love you. We had far too much fun and experienced things together that a lot of people just will never get to experience. So I can tell you one of the first moments on the trip when I realized that, wow, why I'm really here and why, I don't know. The first night we flew in through Johannesburg and stayed in a hotel right near the airport. And then the next day we drove through their downtown and then moved on to the Apartheid Museum. And as soon as we got off the freeway, on the right-hand side was the city, and on the left-hand side were miles of slums. It was mud huts and like sticks. They had like sticks that were strung together and then like plastered together with mud, and then the tops had the metal, like sheet metal, as a roof. And this was miles of it for people's homes and neighborhoods. And we had all been super giddy and excited in the bus, like looking forward to going to the museum and then driving into Swaziland that day. And as soon as we passed by it, we just were all dead silent. And that's when it was real. So that was a crazy moment. Let's see. One of our other first days, when we first went to the hospital, we did a tour, and just to see all the different wards, and they were making huge strides towards more organized and cleaner facilities. But like the pediatric ward was one of the oldest wards in the hospital, and I would say that it was supremely underfunded, and I couldn't tell you the last time that it had actually been renovated or really fixed up. Not to say that it was dirty, but I think the floor itself is from like the 40s or 50s, and there was paint peeling everywhere. There was cracked windows, doors. There's no central air conditioning. They leave the windows open, the doors open. Just outside the pediatric ward are cats roaming, birds. So that was interesting. Oh, as a nurse on the pediatric floor, you don't give the meds to the kids. You hand the medication to the mothers, and they give it to their kids, which is very different here in the States. Everything is out in the open. No one has their own room. No one has dividers anywhere. It's just everyone's together. And while at first I thought that, it was kind of really weird and it seemed like, major violation of HIPAA, which they don't have there, it actually kind of seemed to make sense after a while, because the nurses' station was up near the front and you could see everyone from the station. So it was kind of nice to constantly have an eye on everyone, and also the fact that every mother was out in the open with their kids. They were able to kind of bond and be together, and I saw that some mothers would bring in food and then give it to the other mothers and the kids, and then the kids would like sit together. The ones that were healthier, they would sit together and play. The one day we brought in books and coloring, like colored pencils and whatever, and we were just sitting with the kids, and it was nice because I think they felt like they were kids again, because there's really not, I don't know, there's not a lot of stress on the kids being kids, it seemed. Like, even children's hospitals here, they have, like, toys or playrooms or, I mean, it was brightly colored. They had, like, different paintings on the wall and murals and whatever else, but there didn't seem to be a lot of, like, emphasis on keeping the kids happy, you know what I mean? So, that was kind of hard. I think they have, okay, the first day that I was on labor and delivery, switching gears, there was a woman that was having a really hard time. This was like her first labor and her first pregnancy, and she was really scared, and she kept shying away from the midwife, and so she would like scooch away and like close her legs, and the midwife would smack her legs to like keep them open, and she was like yelling at her, and they do this to everyone. And finally, like, she's starting to give birth, and like another midwife comes over and she's like pressing on the woman's stomach, and then the other midwife is like tugging to pull the baby out, and I'm just like, holy crap. And finally the baby comes out, and they just hold the baby like this and carry it around. And I'm like, should we like cover up the baby and cradle it and take it to the other room, like get it warm, clean it? Well, I know you don't like bathe the baby right away, but still, it's like, could we baby the baby? And the nurse is like, babies are strong. And that was something I never really heard before. And it is so true. Like, these babies, these mothers, they are strong. Like, I have never seen anyone go through labor without anything, without company, support, no families allowed, no men. They have no privacy. They're just on an examination bed out in the open, in the middle of the floor, and no pain meds, nothing. And they labor by themselves, and then they finally give birth, and then they clean off the baby, go and weigh the baby, wrap the baby up, put the baby on the warmer, and then eventually they give the baby to mom, and then send her over postpartum, and she's there for a few hours and then goes home. And I'm just like, this woman just worked her butt off to give birth to this baby and had no one to help her, because the midwives are not supportive, really. Like, they weren't really that kind. And it wasn't to say that they weren't doing a good job or that they didn't know what they were doing, because they seemed very well educated and they knew what to do. But I mean, it was intense, and these mothers just did it, and they were just awesome at it. And so that was really crazy. It was amazing to see just humans being humans. You know what I mean? Like, just, I was like, yeah, women power. Like, these women have got it. Like, I don't know. And I loved labor and delivery. I thought it was incredible. And I think that's one of the things I learned about myself on this trip, is that I think I'm going to be a midwife. I loved it so much. I loved being there in that moment where you have, like, you give birth to a new person, and there's all of a sudden, like, new life, and being able to help the mom, like, the very first mom that I helped, she said afterwards, she was like, if it wasn't for you, I wouldn't have been able to do this, which, I mean, it's not true, but to be appreciated and to be there in that moment to help that mom to bring her child into the world was just incredible. And I can't wait to see if I get to do this forever. So that was incredible. Let me think, what else? The clinics were a whole different experience. So Monday through Friday, the nursing students were in the hospital on different floors, and then on the weekends and then, like, a few choice days, we went to clinics out in like the mountainside with the other students, like the pre-med students, and we did checkups on kids, like different students, and then we had go-go's, like the grandmas, come, and anyone else that had heard about the clinics, they would show up, and they would tell us about, you know, what's bothering them, and we had some over-the-counter medications that we had divvied up and prepackaged for each clinic. So if someone needed, like, cough syrup or Tylenol or whatever, we could prescribe it and then give it out, and then explain how they used it and why they used it. And majority of the older patients that we saw had aches and pains, you know, their joints, and they were tired, and a lot of them had really severe hypertension, and that was really hard for me to not be able to help them. You know, I was explaining, your blood pressure is really high. You can try and eat better, but a lot of these people were really poor, couldn't afford food to begin with, and so they couldn't really eat any differently than they already were. And then to say, you know, you have to go to the hospital, you have to get medication. I mean, I had one patient and her blood pressure was 198 over 112. And I'm just thinking, this woman's going to have a stroke at any moment, and there's nothing that we can do. And, I mean, literally out in the middle of nowhere in the mountains. And it took us like an hour and a half to drive up there. So, and we drove. Most of these people are walking. Like, most of the people that came to our clinics walked for miles just because they knew that there were nurses. And we're not even technically nurses, we're just nursing students. And so it was a lot. It was a lot of pressure to put on us to have, you know, like, help these people. And so that was hard. That was hard, not being able to fix what they needed. It was hard not being able to follow through with the patients. It was hard to not get them, you know, beta blockers and explain antihypertensives and the risk of stroke and what to do during a stroke and how to get home and how to go to the hospital, and I don't know. So that was the overwhelming older population, most of what they had. And then the children mostly had cough. And for the most part, it was cough because of all the dirt, because it was dry season and the winter while we were there, so there's a lot of mud and dirt everywhere, and people would kick it and knock it into the air and then breathe it. I mean, we had that issue, and but some of them had, like, I know a lot of them had asthma, and that was one of the problems that we ran into while we were there, was people having asthma and not treating it properly. A lot of people don't use inhalers. Some people think that it's witchcraft. Some people, they take like the oral corticosteroids or whatever else, and then they leave the inhalers whenever they run out of the other stuff. And then they don't understand, like, going back for checkups. They don't understand going back and refilling their medication when they run out. They don't understand, like, triggers of asthma. So that was frustrating. I think when we have a final paper that we have to write and pick a topic that we noticed, like, was a big issue, and mine was health education. Like, there just being a total lack of health education in the general population there. I know that here in the States, there's a lot of influence for nurses to educate their patients, not just, here's your medicine, we're doing this procedure, blah, blah, blah. It's, here's your medication. This is what it is. This is how it works. This is why you're getting it. This is how you use it. This is how you know it's working, all that stuff. And, or, like, you have this condition, or you have this illness, and this is how you treat it, or this is how you cope with it, or this is how you prevent it. There was none of that. And people didn't understand why you would wash your hands, or drink more than a cup of water a day, or the true importance of eating fruits and vegetables, or bundling up in the cold, wearing shoes, getting a good night's rest, stuff like that. Stuff that we take for granted that most people here know. They don't understand it. One of the huge things, too, that I noticed was most everyone that came to clinics would ask for tablets or injections. And a lot of times they didn't need medication. We didn't have any injections. Or if they did need medication, a lot of times it was medication that we didn't have or didn't have the authority to prescribe. And it seemed like a lot of people just wanted a cure, like, take this tablet and you'll be fine. They didn't really understand, like, long-term treatment, long-term care, prevention. They didn't understand keeping up with meds. They didn't understand how, like, you can buy Tylenol over the counter, but if you needed something like beta blockers, you can't just buy that over the counter. That you have to go to the doctor, and you have to get a prescription, and you have to, keep up with it. You can't just be done after 6 months and then expect your blood pressure to stay down. It doesn't work like that, and I interact with a lot of people that didn't understand that. I'm not saying that everyone was that way. There were many people that we interacted with that were very well educated, but it seemed like there was a good amount of people that didn't know. And so my hope is that we can possibly organize a health education program that we can implement in the hospitals to teach patients that are already in the hospital all the things that we educate patients on here. Okay, so you have diabetes. This is what it is. This is how it works. It's a long-term thing. You need this, 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 and this to treat it, and you need to come back and have regular checkups. You need to check your blood pressure, or not your blood pressure, your blood sugar consistently, and you need to avoid these foods, and then eat these foods and blah, 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 you know, education. And here, like, they would just, I noticed, not every case, but there are many cases that I noticed where they just gave the tablets and said, go home, you know, and I have a feeling that if people were just more educated, that there would be fewer hospital admissions, fewer hospital bills. People aren't coming in to get nebulizing treatments every day. Like, it's going to save the family money, save the hospital money, save the hospital time. Like, there's a whole section in the emergency room just for asthma. And that's insane. Like, and a majority of these people are just coming in for nebulizing treatments because they ran out of their medication and they don't understand that they need to go back and get prescriptions. And I think that there should also be something implemented into the curriculum. I don't know if schools throughout Swaziland have a sort of health course. If they do, I would like to see how they implement it. What exactly are they covering? Do the teachers understand what they're teaching? Do the students understand, like, the importance of whatever? There were students that I interacted with in one of the primary schools. One of them had an STD. And if they understood the importance of safe sex and wearing condoms and, you know, just stuff like that, that, you know, we take for granted here, that we understand that quite a lot of people there don't. And everyone has always heard that phrase, you know, give a man a fish, he'll eat for a day. Teach a man to fish, he'll eat for life. Like, and that's so true there. Like, if we worked alongside the people that were there and had these programs and, you know, just started teaching people, they would thrive like crazy. And, like, these people have the potential to take care of themselves. I think they just haven't been given the resources to do that, you know? And like I said, the people that I met in Swaziland are some of the strongest people I've ever interacted with. And they're very intelligent. They just haven't been educated in the sense that, like, what they can do to help themselves, you know? And I also, I mean, if you know me, you know that I'm a feminist, but if the women there were given more freedom and more influence on educating them, protecting them, you know, letting them have the right to own property, the country would be a lot better off. Like, there's so many countries that, you know, once you educate the women and help the women, and then the women have the same rights as men, those are the countries that thrive. Like, hello, women are awesome. So, that was a little frustrating. I will say that the people that we met in Swaziland were the nicest, friendliest people ever. Like, we were in one of the huge cities, and we would walk by, and everyone would just be like, hi, how are you? Like, how's your day? Like, you know, and not, like, trying to stop you and really, like, harass you or whatever. It was just, like, genuine, like, how are you? Like, I hope you're having a good day. And the kids that we interacted with, like, the orphans that we interacted with that lived in the middle of nowhere on the mountainside and walked forever to get to school, they were just so vivacious. Like, they were just so full of life, and they were just happy and cheerful, and they were just like any other kid. Like the one little boy that I interacted with, he just, I don't know, his name's Siabonga, which in Siswati means thank you. And, like, his parents named him that, you know, to thank God for their child. And he was brilliant. He's 11. and he is fluent in English and was teaching us Siswati and was acting as a translator for one of our clinics. And he's just, but he's still an 11-year-old boy. He was like knocking down stuff and playing with his cars and like making a mess and like being loud and blah blah. I'm like, even here, still a little boy, like being a little turd and like picking on the girls and whatever else. And it was just funny to see that, like, no matter where you go, that kids are kids and people are people, you know. I think that, at least for myself, you know, I had this perception in my mind that, like, this is a very poor country and these people aren't educated and, like, they're completely different. And they're not. They're just like anybody else. And I felt pretty stupid going in there with that assumption because I thought that I wasn't like that, but I was. And it turns out that these people are just like anybody else. And so that was interesting. So in other news, I went to the elephant sanctuary, and it was the greatest day ever, besides, you know, the fact that I got to go to Swaziland and the day that I got into nursing school. I have wanted to see an elephant in person since forever, and they're my favorite animal, and I'm pretty sure everybody knows that, but I was so freaking excited. They brought the elephants around, and we first like got to go up and touch them and like feel their ears and their trunks and their tusks and their stomach and their toes and their tongue. They had us feel their tongue, which was really weird, and it was like really smooth, wet muscle. It was weird. And then we posed with the elephants, and then we walked them. So you like stand with your back facing the elephant, you stick your arm out behind you with your hand out like this, and they put their trunk out and they hold onto your hand with their trunk, and it was so cute. We like walked them in a circle, and then we fed them. Like we went up and like had our hands full of like these little treats, and then poured it into their trunk. So and then we rode the elephants. They're back. Awesome. It was so cool. Like we had to go up on this huge platform and climb on top of the elephants with the trainer, and then they like walked us up this hill. It was so awesome. So great. We went on 2 different safaris. One in I think it was Shlani in Swaziland, and that one was awesome because it was smaller, so all the animals were in like a more confined space, and then you could easily like find them all. But then we went to another one, and it's called Kruger, and that was in South Africa, and that was huge. It was like acres upon acres, and we traveled around. We were there all day. Like it was a huge park. We actually, it's kind of sad we didn't see any lions in that one, but there are actually thousands of elephants in that park, and we saw zebras and impalas and gazelles and birds and crocodiles. Yeah, alligators are the ones that are only in the U.S., I think. Hippos, rhinos. What did we see? Giraffes, that's it. We saw one jaguar. I spotted it, and they're really hard to find. I don't know. We went to a cultural village in Swaziland. That was awesome. They had all these dancers perform and sing, and the one lady was absolutely incredible. Like Whitney Houston, incredible. I was like, holy crap. They explained like the layout of the village and what like each hut was. We went hiking up this mountain. We went hiking by this waterfall. Then when we went to leave, and we left like through South Africa. We spent like a whole day sightseeing, and that was incredible. I mean, we were on top of this mountain on all these different cliff sides, and you could see for miles, and it looked like something out of like Avatar, like where the blue people were like flying their little like bird dragon things and like landing on the cliffside. That's exactly what it looked like, and it was just amazing. And there's like monkeys on the mountainside, and you're just like, holy crap! Like, and the crazy part about it too is like most of these places that we went, there weren't like buildings around, there weren't like houses, there weren't anything else. It was just untapped land where you could just go and like be on top of the world, literally. And that was incredible. It was, I remember standing on the one cliffside, and you could see down, and there was a valley, and the river like ran through it, and then there were like stacked mountains adjacent to us, and you could see more off to the right, and then off to the left past the valley you could see like everyone's farms and like the flat land, and the sun was setting over the hill, and you could see the sunbeams bouncing off the hills. And I was like, this is why we travel. This is why, for moments like this where you're just there in life. I don't know how to say it without it sounding absolutely ridiculous, but it was just, that was it. And there were so many moments throughout this trip that I was like, this is why we're here. This is why I'm going to be a nurse. This is why I want to travel. And I'm just so grateful that I got to go. And thank you guys again so much for everyone that helped me pay for this trip, that sent me supplies for the trip. Aunt Key, all those stickers that you sent me, awesome. I passed them out at one of the clinics, and it was a huge hit. There was one place that we went that had all these kids in this village, and we just went around and I put a sticker on every single kid's forehead, and it was so cute, and they would like run over and grab their friend that didn't have a sticker, and so that was great. There are so many more moments from this trip, and I'm sure that I'll tell you them if I run into you. But I figured that this would kind of be helpful so then a lot of people can see the video. So, thank you again, and I'm so happy to be home, and I'm so happy I got to go on this trip. Thanks.